want to have it go away, but they aren't doing it in a way that's normal for a democratic society. Two options open if you don't like a piece of legislation and you're an elected official. The first option is to offer an alternative that would take care of the root problems, the ones that we just talked about a minute ago. The solutions that have been offered in a lot of cases on the Republican side don't address the real problems. Or if they do, they only take care of a fraction. They only make sure that a fraction of people are covered, or they only take care of a fraction of the cost. So that's one option. You can offer a complete new solution to these problems that nobody argues about. I mean, everybody knows that these difficulties that we mentioned before and many more, they exist. So nobody's arguing about that. So that was the first option. They could do something to replace it. They have not. The other thing that in democratic society, if you're an elected official and you don't like a piece of legislation, you work to change it in good faith, to make it work better, to solve those problems. If you're not going to replace it with something else to solve the problems, then modify it in good faith. And we haven't seen that either. In fact, make it better to perfect it. And that's not acceptable. I'm not sure whose governing philosophy it is to not participate in the process, but it's a destructive one, and it's dangerous for the future of our country, for the future of our states. And the reason why I'm here today is it's dangerous for the health of my residents, of my citizens, the people that count on me to promote smart policies. So if these aren't options, then I'm worried. The fact is that Obamacare, that the Affordable Care Act, is law. It was put into effect, and certainly there are very few laws that are perfect when enacted. Very few. I can speak from experience. Some are, but they're the exception rather than the rule. So there are going to be things that need to be modified about this law, and we need the participation of everybody. We need all of our elected officials at the table in the conversation, discussing how we solve these problems. And that's in all of the hype and the discussion and the yelling. That's the point that always gets missed, is there are existing problems, existing difficulties that face us every day. And maybe because, like I told the Dayton Daily News reporter a minute ago, maybe because I'm a commissioner of a city and I talk to a lot of people, it's in my face every day that these are problems that we need to be addressed, and we need everybody at the table to do it. So instead of taking like the normal 8-year-old would take the ball and go home, instead of sticking around and playing and figuring out a way, negotiating and figuring out a way to iron over the difficulties and stay and play, the legislators that we have at the state level, and our Representatives Turner and Representative Boehner, they're taking the ball and they're going home. And that's not effective on the playground if you're 8, and it's not effective in government either. There are plenty of alternatives. There are plenty of ways my citizens and my employees, and that's just not acceptable. So I'm here to urge everybody to come to the table. Let's work together on this. Let's perfect the legislation. If there's something you don't like about it, let's talk about it. Let's figure out a way that we can take care of it, instead of just sniping and sort of not doing anything productive to solve these problems that our citizens have.
Being ginned up right now. Disinformation is more common than real information, and we need to challenge our elected officials to give us accurate information so that we can get about the business of getting people covered for health insurance. My name's Bob Mendenhall. I worked 34 years with Social Security Administration. I joined the National Committee for the Preservation of Social Security and Medicare. About 5 years ago, I opened up a rock and roll tavern down the street, Blind Bob's, and that was with my wife and my son. This past May, we opened Lily's Bistro with my wife and my daughter. Thank God I have no more children. That's all I can do right now. But we measured one of our early milestones of success was to offer health insurance to our employees. And maybe I just look at things differently than some small business owners. I was told by the local restaurant association, congratulations, you're part of 5% of the industry that offers your employees health insurance. Shame on that other 95. That's all I have to say. Who wants a sick person handing them change at the grocery store? Who wants a sick cook in the kitchen cooking your food? Who wants a sick anybody working when there can be so much better than that? It is beyond me why we want to promote the lack of health insurance in our community. It makes no sense at all. I think is important. When we started health insurance, we had an employee named Andy. I tell you that's a made-up name, but it's not. It's Andy. Andy had strep throat, right? Andy never had health insurance. He's sick 2 days. I call him up. I'm at home. I'm sick. I got strep throat. What are you doing at home sick? Well, I got strep throat. Andy, you have health insurance. What does that mean? It means you get to go to the doctor and they'll take care of you. He had no idea how health insurance worked. He'd never been to see a doctor. He's got strep throat. We all know strep throat turn into scarlet fever. I mean, it gets serious. He had no clue. I mean, so it was interesting. I had a cook, fell off his skateboard, broke his collarbone. He's in the emergency room. His mother's on the phone. He said he was going to drop his health insurance. Did he drop his health insurance? You know, they're going to do one course of action if he has health insurance and one course of action if he doesn't have health insurance. Yeah, he's still got health insurance. Thank God they're going to treat him. What's wrong with that story? That's crazy. You know, and that is actually our experiences with what's going on with health insurance, offering it to our employees. Hospitals. As was mentioned earlier, the Affordable Care Act, Obamacare, it actually draws its energy on private insurance companies providing competition. That's capitalism. You know, that is not socialism. And I fear the ignorance when I hear people say Obamacare is socialism. That's a lie. It's a flat out lie. You know, I saw Rand Paul on TV the other day. I use that term loosely, saying him. But disinformation. He's saying 15% of the country doesn't have health insurance. And I'm thinking, that sounds kind of low. I got to tell you, I looked it up. He's right. It is 15%. There's still a lot of people without health care. What he didn't say about that 15% is it included everybody over age 65 that has Medicare. Almost everybody over 65 has Medicare. You take them out of the equation, and it's a lot more, than 15% of the people that don't have health insurance. And I talk to people up and down Fifth Street all the time, and I'm sure that our commissioner talks to people in the city of Dayton all the time. I can tell you the middle class and the working class have a lot higher rate of people not covered by health insurance than 15%. And that's one of the things that I think we need to start getting better information out towards about who does Obamacare, the Affordable Care Act, help. It helps the middle class. My Republican friends are starting to ask me, can my son be covered under health insurance now that he needs the stomach bypass surgery? Huh? Yeah, it's like, you know, they're going to badmouth Obamacare, but they're starting to ask questions about what are the benefits to my family. And that's what we need to get about, is to get that kind of information out. And we're not getting it through the state. The battleground, the battle lines right now for bringing health care to people in the state of Ohio is the State House. We need to get Medicaid expansion, and if we don't get it, we need to create holy hell over the issue. Those are folks, the middle class, the working class, that are going to be impacted by what's going on with the exchanges, and it's not going to happen if our state legislatures doesn't go through with it. I have heard Mike Turner and the Republican congressman John Boehner talk about repeal and replace Obamacare for the last 2 years. Repeal and replace 40 times. I won't go on 40 times with repeal and replace, but you get the idea. It's a broken record. I've never seen the replace part. I've heard the repeal part. We're talking about replacing it with nothing, unless you're talking about the Ryan budget, which is gutting Medicare. And you know what? The Republicans were so embarrassed by the last Ryan budget when they trying to pass through a budgetary issue. Not even the Republicans would vote for the Ryan budget. Repeal and replace. They're just trying to kill the baby before it gets up and walking, because they know people are going to like some of the benefits from the Affordable Care Act. And we need to get it up and rolling and that information out there.
Have more events like this. I was asked to talk today about why I support the Affordable Care Act, and I wanted to share a little of my own story. I've been working since I was 15, 13 if you count my brother's paper route that I took over. I graduated from Bowling Green State University in 2004, and I moved at age 21 to Chicago. Since then, I've worked as a barista, a server, a bartender, a PR and marketing coordinator, a freelance writer, editor, and consultant, as an organizer, and now as a restaurant manager and business owner. So over the 9 years, I've held at least 9 jobs, frequently 2 and 3 of those at a time. Most of the time, I just finished a freelance project yesterday. I only received health care from my employer for 2 of those 9 years. I tried the individual coverage route. It was so expensive and it covered so little that I gambled with my physical and financial health for nearly 6 years. I learned firsthand how stressful being uninsured is, how expensive and unhelpful individual plans are. My chef and I were talking about this yesterday. And how confusing it is to navigate the world of insurance alone. I looked up what my plan would be in Ohio right now, yesterday, just for this. It could be anywhere from $120 a month to $720 a month. So we need some better information about what those things mean. And really, truly, almost everybody my age has a story like this, and that's just wrong. I wish Obamacare had been around when I graduated in 2004. I then could have stayed on a family policy until I was 26. By 26, I certainly had a much better idea of the path that I was on than I did when I was uninsured in a new city on my own when I was 21. I'm proud as a businesswoman and as a woman that Obamacare will ban gender discrimination in the pricing of insurance policies. It never should have happened in the first place. Why should it cost more to insure the women? I want to give a shout out to Amber Brady, Amber Singleton, Nicole, Jenner, Lisa, Jen, Chelsea, Cassidy, Liz, Mariah, Amy Lane, Amy Cakes, Daniela, and Veronica. All these wonderful women who work at Lily's and Blind Bob's. Why should it cost more to insure them than it does to insure all those good guys who work there? Obamacare means that the insurance companies will finally have to cover the real health needs of real women, like annual visits, Pap screenings, contraception coverage. Again, it's about time. One more thing, if Obamacare had been around sooner, then insurance companies would have stopped denying coverage for pre-existing conditions. This finally happens next year. It's about time to see that happen. Everybody my age has some pre-existing condition or will soon. People like us really need Obamacare. The story my father told about Andy and strep throat, I've been that person. And then I was a person who's been insured and uninsured, and I've actually had the moments that I thought, do I want to go to the doctor and find anything out? Because I know it's quite likely I won't have insurance in 3 months. And then what happens when I try to get it again? That's not right. Business owners know how to do the math. Here's how I add it up. Obamacare is good for my business and good for my family. It's good for our employees. It's good for our neighbors, and it's good for our state. In short, I'm for it. I wish all of our elected officials would see the way that we work at Lily's. Real teamwork means great food, great service at a reasonable price. It means working together. So I challenge Mike Turner and John Boehner. How about it? Show me some teamwork that works for all of us, instead of just partisan posturing. Every day at Lily's and Blind Bob's, we put people first. And by offering insurance benefits to our employees, which as my father mentioned, we've done since September 2010, which was 2 years after Blind Bob's opened, and a shout out to my mother who really played a huge role in making that happen. We demonstrate that we truly value our staff and we want them to be happy and healthy. But voting 40 times to end healthcare reform, as Mike Turner and John Boehner have done, I have a message to them. Neither one of you would last long at Lily's or any other small business with this lack of concern for putting regular working people first. Thanks. Small businesses have been waiting for years. Middle-class people have been waiting for years. Women have been waiting for years. Young people have been waiting for years. I know I'm all of these things. Obamacare. It's time to move forward together and make affordable health care a reality for everyone.